Hi, everybody. We're about to start our next session in the SDG Media Zone, coming to you live from the UN General Assembly this week. And it's my great pleasure to introduce the next panel on mental health and youth. And I'm going to hand over to our SDG advocate, young leader. Thank you.
Thank you so much. Good afternoon, everyone. It's a pleasure to be here. I'm Mayada Adil. I'm a doctor, a fashion designer, a United Nations young leader for SDGs. It's an honor to be between a distinguished list of speakers that we have today, talking about the rising concern about mental health and youth. It's a topic that I particularly invest in it, and I feel with the recent events such as COVID-19 pandemic and the crisis and more have contributed to the rise of mental health concerns and conditions globally. This session will be highlighting the challenges our young people, our young tribe, are facing and related to the mental health, and exploring solutions with each one of you for promoting positive change and providing support for our tribe. So let me welcome our speakers, Brianna Cayo-Cotter. She's a senior vice president to the Social Impact MTV Entertainment Studio. Thank you. It's a pleasure to have you with us.
Thank you so much.
And also we have Anushka Gupta. She's an Active Minds Youth Advisory Board. Thank you for being with us today.
Thank you so much.
And also Livia, Caligor. She's Advisory Board member from Born This Way Foundation.
Thank you for having us.
Also Dévora Kestel. She's a Director in Mental Health and Substance Use Department from WHO.
Thank you for having me.
So we're going to start by asking you questions, and I would like to participate in your point of view and perspective. What are some of the big challenges we are seeing today around mental health concerns and the young people, and why we are seeing a rise of these issues globally? We can start by Mrs.
Shall I go? Okay.
Yeah.
So thank you for this opportunity. What we have seen is it is a gradual growing interest on mental health issues, and in some contexts the possibility for people to speak about the mental health issues, and that makes it more visible for everybody. But as a consequence or as a follow-up of COVID-19, the pandemic, we have seen an increase of around 25% of people with depression and anxiety if compared to prior to the pandemic. And some of the groups that were more clearly impacted are young people, are women, and also people that were living in those contexts where the pandemic hit the hardest. So here we have some reasons why there is this increase. Now the issue is, what are we doing with that? But maybe there is room for a follow-up question that I could talk about that.
Exactly. I would ask you the same question, Livia. What do you think of that?
Yeah, so what's so interesting is that there's so much conversation around mental health today. It's such a buzzword in the media, and but really it actually is at an all-time high. Mental illnesses are more rampant than ever. The suicide rate among youth are at an all-time high. And I think the primary challenge in combating mental health is the barriers to access. There's so many different forms of barriers to access. There's a lack of legislative action and government funding. There are financial barriers for young people who don't have independent health care or can't access the resources. There are educational barriers. A lot of people don't even know what mental health is or don't know how to broach the subject. Also, one of the most, I think, pressing barriers is cultural and social barriers. Even though, like I mentioned, mental health is such a buzzword, there are so many taboos and social stigmas attached to mental illnesses. So as a member of the Born This Way Foundation Advisory Board, we do tackle all of those different barriers to access by advocating to eliminate the stigma around mental health, and also invest in resources for youth.
Incredible work, thank you. I would ask you the same question, Brianna.
Great. Yeah, so at MTV, we've been actually working in the mental health space for the last, I think, 18 years now. And over the last couple years, we were charged by our president to really reinvent this, because we were looking at all these statistics too, even though we've been working on destigmatization, having it in our content, things like that. The reality is when you were looking at the statistics, things were getting worse instead of better. So we needed to take a new approach. And what we found when we developed our Mental Health is Health campaign is, I think, three main things. One is, there has been a hyper focus on crisis in mental health, which is so important, but really there's a huge opportunity to look at the continuum of mental health and help people hopefully develop the skills and the tools and the coping mechanisms and the way to interact with their friends so that we are avoiding more crisis moments. So I think one of the things that we've been seeing and we're really excited about is people really looking more at the continuum of mental health as a core part of your health. And then second of all, absolutely in terms of access, especially culturally competent, culturally grounded access. And that's something that we've really relied on youth advisors through our work and others to help us understand and bring to life ways that really show how communities, especially BIPOC, LGBT, some of the most impacted communities actually have real good mental health tools in their thing. They just are not part of the Western medicine way of dealing with this. So how do you improve access to that? How do you help in that? And then I think finally in this, the woman that was up here earlier said this, and I couldn't agree more, is there has just been way too much focus on awareness, which is important, but we need to move into action on this. And I think we have been just laser, a couple of years ago, yeah, right, kind of in the middle of COVID, we were looking around, we're like, awareness is over. We need to, and we created Mental Health Action Day. We brought in 2,000 partners from government and nonprofits and brands, and have been really hyper-focused on every single thing that we do has to have an action component to it. And I think that that is something that I'm excited, because I know that that is core to how we're gonna also approach all of these SDG things as well. So anyways, that's kind of my thinking on it.
Actions, actions, actions.
Yes.
I agree totally. So we can take a youth perspective opinion of Anushka. What do you think?
Thank you. I definitely want to agree with what Brianna and Livia are speaking about when we talk about accessibility. And I think the biggest thing is that post-COVID, at least what I've seen on my college campus, is that students want help and they're going to their counseling centers, they're going to campus wellness centers, but a lot of these campus wellness centers don't have the funding to provide them with the mental health resources, the therapy that they need. They offer a limited number of free sessions, and then after that, it's kind of like the students are on their own, and finding a provider that's in network is also very difficult as well. So I definitely think that we, as youth and like the young adult population, we are looking for the help. I think that just finding it is very difficult. And again, touching on what Livia was saying about, and Brianna, I believe cultural competency is so important for many immigrants, for many people who English isn't their first language. Having a BIPOC therapist is so powerful because you feel so much more validated when you have someone of the same background and the same ethnicity who's speaking to you, and you don't have to explain yourself and your culture to someone else while also trying to understand it yourself.
Absolutely. I will add migrants and refugees as well. It's
Absolutely.
yes.
Yes, I wanted to complement a bit because I went too short. I didn't know that we were going into more broadly comments. I think it is important that we, at least from our perspective, we keep this global view. And then some of the issues that are already given maybe in some countries are far from it in many others. So I agree that whenever we are at a place where there is the possibility to move forward because it's enough awareness and people are speaking up loud and clear, we need to move into action. But this is not the case everywhere. We are talking about countries where there is one mental health professional for 200,000 people, let alone in a campus. So we need to keep that perspective in mind and make sure that we provide answers and opportunities for everyone, everywhere, depending on the context where they are. And being aware that powerful media communications like this one get to all of them and in a meaningful way, so everybody can hear it properly and take action then accordingly.
Absolutely, I agree. What you have mentioned, it's a great transitional to the next point of think locally and act globally. What are some of the big challenges, how is it your organization or projects supporting young people around mental health issues? How are you promoting for positive change? Can we start with Anushka?
Yes, absolutely. I believe Brianna will speak about this a little bit more, but the partnership between MTV and Active Minds to create the ASK campaign. ASK stands for Acknowledge, Support, and Keep in Touch. So Active Minds is a national nonprofit organization with hundreds of chapters across the country. And what we're trying to do with ASK is create a peer-to-peer mental health tool. So as we were all describing, there's such a lack of accessibility to mental health services. And what ASK does is it's a tool that's simple, but so effective in helping peers speak to one another about those difficult conversations, about therapy, about self-care, medications, all of these things. And asks, if I can just go over it really quick, but acknowledge, right? So acknowledging that it's very difficult to talk about these things, acknowledging that everyone has the right to be upset as much as they have the right to be happy. And then support, again, asking how someone wants to be supported is so important, rather than assuming that the person that you're speaking to wants to be supported the same way you want to, which isn't always true. And then keep in touch obviously looks different depending on who it is, whether it's a friend, a colleague, whatever, but sometimes a text, a call can go a long way.
Thank you so much for what do you think?
Yeah, I mean, I agree completely. And
Complimentary.
And I mean, I think a core insight there was, to everybody's point, is with the lack of access there is to mental health services, there's a critical role that people can play in each other's lives if you're not able to access more kind of more medical care or things like that. And not every case even needs that. They need somebody to do that. So super excited and proud of the work that we have been doing with Active Minds and the Youth Advisory Council. And also as a media company, our core business is content. And we know that what people see changes the way that they think and believe and take action for themselves or others. So we've also been hyper-focused over the last couple of years on developing the first ever mental health media guide that allows content creators from and we have every other major global media entertainment company on board with that, nonprofit expert community that has helped us actually give creators the tools to tell powerful mental health stories that show people what to do in those things, and in a way that's entertaining and part of their favorite show. We had a healing circle that we did with Beam on The Shy last week, and then we were able to actually give our audience of The Shy opportunities to join healing circles in their communities. And so I think that and that's another place where, I mean, we're a global company, all the other media companies that are part of the coalition also are, so these are stories that go kind of far beyond borders, and we know will have an impact and are having an impact on the way that people think about mental health.
Thank you so much for your profound work that you do with the youth. I'll ask you, Livia, what kind of work that you do in your organization to support them?
Yes, thank you. So for those who don't know, Born This Way Foundation is an organization founded by Lady Gaga and her mom, Cynthia Germanata. And what's really special about Born This Way Foundation is that it was really created for youth. As Lady Gaga always says, it's led by youth for youth. So the central mission is to really understand and listen to different youth perspectives and see what issues they are grappling with and how mental health affects them, and to tackle those issues based on the perspectives we're hearing firsthand. So we have a youth advisory board of 31 young people all over the world who share their perspectives and work on local initiatives, and we really want to hear what they're going through and what global crises are affecting them the most. So I think now more than ever, there are so many overlapping global crises that are only exacerbating the mental health epidemic, from climate change to xenophobia in the wake of the pandemic. There's so much isolation in the digital age, anti-trans legislations. So all these youth provide us with their different perspectives. And one of our initiatives, the Kindness and Community Fund, is a call to action for young people to nominate one organization, a local grassroots organization that's special to them and that they find to be supporting their needs. And we have an extensive review process, and after reviewing all the organizations, we invest in resources for them. So this year, with the support of Cotton Foundation, which has only allowed us to amplify our mission, our goal has been to raise $5 million by October for youth mental health. So really, at the end of the day, you can't really know what what someone else is going through or what you need unless you've gone through it yourself. So that's why hearing and prioritizing youth perspectives are really central to our mission.
Absolutely great. Thank you.
And
Over
so, thank you. And from our side, I think that, traditionally we work with ministries of health to strengthen their capacities to answer to the needs, because when some of the tools, like the ones mentioned earlier, are not enough, you still need a health professional duly trained, knowledgeable to do and intervene and follow up and do what needs to be done. And that is what is lacking as well. And so we need to think in a complementary manner. And we are working with ministries of health and the communities at country level to ensure that capacity grows everywhere. We have developed a number of tools, others are to be released, so hopefully you will hear about that soon. One for younger people that is called EASE, developed with the support from young people, and we hope that we'll have a good intake. And then we are developing also a brief on how services for young people should be, children and adolescents, should be developed at country level, so that they are not put in situations that are very ugly, in ugly institutions, in ugly contexts, so that things are taken care of properly. And we have a common, a joint program with UNICEF that we implement in a number of countries, again, trying to bring all these nice theories into concrete action at country level. And we have a number of countries where we are implementing this joint program, and we hope that we will be able to multiply the number of countries. Some of the interventions are related to promotion and prevention at school, or then early intervention whenever it is needed. So I think that if we learn from each other and we make sure that whenever we work in countries that are less rich in terms of their own capacities, we talk to each other to make that a bigger impact, perhaps, and that will be fantastic if we can follow up from this.
And do collaboration together. That will take us to the last question, and we have 3 minutes to wrap it up. How are you working with the young people and support the youth commitments around raising awareness of mental health? How can individuals take actions when they can see someone struggling with mental health? I think you have.
Thank you. So one of Born This Way Foundation's most incredible and impactful initiatives in my eyes is the Be There certificate. It is a free hour-long online course that teaches you tangible skills to really be there for someone and support someone when they're going through a mental health crisis. So if you haven't personally, I'm sure all of you can think of someone who has been dealing with mental health and has come to you. And it's a very awkward topic. A lot of people, especially of older generations or from different backgrounds, a lot of immigrant families don't know how to broach a subject. And the last thing you need when you're going through a mental health crisis is to feel even more lonely and confide in someone and not get the help you need. So it really is very powerful because it's very tangible, action-driven skills. Once you take the certificate, they're actually available on your mobile device, so you always have them with you. And once you've taken the course in a low-stakes environment online, you can always pull them out when it's urgent. So there are 5 golden rules. The first is you say what you see. So instead of saying, you seem depressed, or projecting, a diagnosis onto someone. You're not a psychiatrist or a therapist. You say, I noticed that you have been X, Y, and Z, and you mention how their behaviors have changed. You can say you've been, isolating, you haven't been as responsive, you've been, using substances, and these are the changes I've noticed in you. Then you show you care. You say that, you've noticed these changes because you care about them greatly and you want to support them through whatever is the root cause. Then you hear them out, so you listen to their perspective. And then finally, you know your role and connect them to help. So ultimately, the most important thing you can do is connect them to the proper resources.
Absolutely, I agree. Over to you.
Yes, I mean, I actually have a Be There certificate. I've done it. And kind of similar is the ask that we've been developing it has a lot of similarities. And we just launched it this week at the VMAs, and we are really excited to figure out how to take it as big and global and get huge partners involved in it. We've had success of that in the past. Try to figure out ways like Be There has to give people the opportunity to actually practice and see what that looks like. And so anybody that is interested in joining us in that, we're just at the very beginning stages, and we've been thinking, this might be too US focused, but in the US here, you learn when you're a kid what happens if you're in a fire. You stop, drop, and roll. And we really believe that there needs to be something like that for emotional intervention. We think Ask can be that. So if anybody wants to join us in that mission, please
I'll definitely
come on board.
join. Definitely.
Justask.com, I think. Ask to help.
Yeah, just to kind of piggyback on what Brianna was saying, just reminding, I think, youth that you don't have to be an expert, you just have to be there. And that's something that Active Minds always loves to talk about. I think we always search for the right thing to say, like it's some sort of recipe, but that's not how these conversations work. So I think that Ask can really be effective in providing a blueprint.
We have set up at WHO a youth council that advises on any health matter. Mental health, no surprise, has been identified as a priority, and we are following up with them. Thank you.
Thank you. Thank you so much for your intervention and profound knowledge. And we're going to join the movement for sure.
Great.
Thank you. Thank you so much. Follow us for more.
Thank you so much.
Thank you.
Thank you.